Hey everybody, it is Dr. Heather Hammerstedt from Holist, and I would really like to welcome you to a Medical Monday here today to talk with me and Holist. For those of you who are new, I'm Dr. Hammerstedt. I am an emergency physician and founder of CEO and Holist. I have a passion for nutrition and for integrative and lifestyle medicine. Holist uses education and evidence to empower people to make choices to become healthier and become more well. I do wellness coaching around mindset, fitness, and food, and I love curating services and products for all of you. So this means that on Medical Monday and on Wellness Wednesday and on Skin Saturday, you'll find me here bringing you free information. So thanks for tuning in. Today I am with another awesome mama doc named Dr. Melissa Welby, and I am trying to get her on here. Melissa, make sure you're in landscape mode there, and I should be able to add you. So Dr. Welby is a Connecticut-based psychiatrist who's going to talk to us today about anxiety and how to use integrative and alternative wellness techniques. And she's adding us right here. So, hi,
Hello.
Good timing. Got you right on there. Welcome.
Yay.
Wasn't quite as hard to get on as it seems.
I know.
Times.
I thought it was going to be worse.
Yeah, good. So I was just introducing you a little bit in the context of sort of our Medical Monday, and what I like to do is bring people education and evidence to sort of empower them to be able to make their own lifestyle changes. I love to invite my fellow female physician entrepreneurs, especially my other mama docs, on to sort of talk about, you know, what you do that's unique and the services that you offer, and really just to be able to provide some education for our larger communities, yours and mine, in this particular situation about anxiety and about things that we can do that are non-pharmaceutical in terms of therapies or food or exercise. And so I'm really excited to have you here. And how are you today?
I'm great.
Good. I'm glad. So I hear that about 20% of Americans struggle with anxiety disorders, and that may be low, may be high, but to me, that sounds like a huge health issue that we don't talk about enough. And so can you tell us a little bit about what that range of anxiety, from like normal anxiety to kind of more debilitating anxiety, you know, what that looks like?
Yeah, I mean, anxiety is normal, and we all have anxiety. It's healthy. People are texting me. So sorry, I can't see anything.
Yeah.
So, you know, we don't want to get rid of anxiety. We want to harness our anxiety. It's when it becomes pathological and it takes over that it becomes so problematic. So that's where you see the 20% that it's really interfering with functioning at that time.
Gotcha. Great. So I really love geeking out about the body's complexity. I think, you know, even though I'm 15 years into a medical career, I'm still just like absolutely amazed that everything works as well as it does. And I like to get into the science of that. And so in my Weight Science to Weight Wellness coaching program, we talk a ton about insulin and cortisol and estrogen for weight and storage of fuel, which for me was something that I did not learn in medical school. I did not learn it in my training. It was something that I just sort of, as I said, geeked out with on my own and kind of came up with these coaching programs. But through the process, I've been seeing also, you know, information about insulin and cortisol and estrogen for anxiety, which was surprising to me because I'd already sort of thought of anxiety as more as a serotonin, like neurotransmitter thing. But tell me a little bit of what you know about, you know, insulin, cortisol, estrogen relation to anxiety.
Well, I mean, the cortisol one is easy because that's sort of the fight or flight, and, you know, stress and anxiety is going to release cortisol. All of our, you know, we want to be able to escape from attack, and we need our adrenaline in our fight or flight system. But the anxiety is just where it goes awry. We don't need to fight at that time. So that's a little clearer. The estrogen is fascinating because the estrogen is related to the production and transport of serotonin, and I think prevents some of its breakdown. And so when you have lower estrogen levels, you have lower serotonin levels, and then therefore more mood symptoms. This is not directly anxiety, but there's research about exposure to trauma and developing PTSD. You are more likely to when your estrogen levels are lower. So there's some protective effect of estrogen. So it's fascinating.
Yeah. Well, I would like to think that anything female is protective, so I like to hear that. So about a week ago for Wellness Wednesday last week, I talked to Dr. Alexis Hugelmeyer, who is at Dr. Lex RX, and I know you know her from some of our female physician entrepreneur groups. And we talked a lot about self-care being an essential health tool. And we talked about cortisol there being that stress hormone that we can bring down to manageable levels there. It can affect weight and burnout and kind of other hormonally controlled systems. And so certainly it sounds like it's essential here too. Can you tell us, is your advice on some sort of alternative or integrative techniques that are non-pharmacological that people can use for self-care for anxiety?
Absolutely. So a lot of anxiety is projecting. Like, people are not living in the moment when they're anxious. So catastrophizing is, people are always worried about, what's going to possibly happen, all of these catastrophic things that could happen. Nothing is necessarily evidence-based in that moment. So a lot of the techniques that are successful are grounding techniques, things that bring you back to the moment. And I think different things work for different people. And so for some people, quiet breathing and meditation is very effective. For some people that are so anxious, that's not enough, and they need something more active, like, intense exercise, or even any exercise or distraction. Some grounding techniques that, like progressive muscle relaxation, it's really hard to not focus on contracting your muscle, right? I mean, to contract your muscle.
Yeah, I'm trying to do it right now.
Right. If you do it, it's hard. I mean, you've got to give it your all to tighten that as hard as possible. So it's a great way to take yourself out of your head and, bring yourself back to the moment. Work
into your body,
your body,
reality.
Work through your body. So I think that for people that are anxious, sometimes some of the passive relaxation is not, doesn't capture that.
Right, like a meditation when you're in the moment of anxiety is probably, maybe meditation is more preventative and than it is, a in the moment fix.
Right.
I can see that. Any of us who've tried to meditative know that it's pretty easy to get down that rabbit hole of wherever it is that you are.
Right. Yeah. I think that's a good point, that it really depends where you are. So there's the preventative parts, which is self-care, and, meditation might be part of that. And then there's when you're really anxious and the management of that. And so, as simple as distraction and doing things that are different from where you are, what you're doing when you're anxious. Go do something else, call somebody, ask how they are, do anything that can distract from that inner sensation.
Yeah. What, tell us a little bit about cognitive behavioral therapy and how that can be anxiety.
So when people are anxious, they become hyper aware of all bodily sensations. And then with that becomes the interpretation that, and a projection about being anxious. And so with cognitive behavioral therapy, a lot of it is shifting the way you think about sensations. I mean, it's shifting the way you think about a lot of things, but just in terms of your body, if you feel your heart racing, instead of assuming and then kind of talking yourself into a panic attack, there are lots of, what is the evidence for or against? You know, could it be that, you know, I just walked fast, or that I'm thinking about something, you know, kind of reframing things that normalizes it and looks at evidence for and against. It can give you a sense of control and mastery over your thoughts, where a lot of anxiety is feeling out of control.
Yeah. So I know that cognitive behavioral therapy is a very distinct kind of way of doing therapy and counseling and things like that, that is definitely in your wheelhouse and not in mine. But I have managed to usurp some of that metacognition stuff just to figure out how people are interpreting the sensation of hunger. Right? You know, are you really hungry? Are you, or is it just that you're feeling something that is associated with a situation or a time where you usually eat? And that's something that we work on a ton in my weight wellness program for sure. So I think it's really interesting. And really that model of being able to think about your thinking is something that can, you know, profoundly change the way anything in your work or your family or your parenting, or, I mean, it's just so interesting. Yeah, it's really interesting model.
Yeah.
So, so I love kind of the potential for multidisciplinary kind of team-based approach to care. And I hear that in what you're saying about an approach to anxiety, right? There's things you can do for yourself, but there's things that you can seek care from other people to help you with. One of the things I'm doing at Holist is creating sort of networks of alternative and conventional physicians and practitioners to work together for kind of a pro-based, a proactive, comprehensive kind of team approach to overall health and wellness. And anxiety seems to be a super, you know, easy program to build around. And so this is really great stuff. And I'm going to reach out to you for kind of picking your brain on some things here once we're off the line. One of the things I do really love to talk about, obviously, is food. And so is there anything about food or things that we're eating and drinking that, you know, compound anxiety? Or is there anything that would help us kind of mitigate when we're feeling anxious?
Yeah, I mean, I think that, I mean, caffeine and alcohol are so frequently overlooked. So when people,
well, because we want to overlook them.
Right.
Yeah.
Right. But I mean, it makes a big difference. So when people are anxious, caffeine is fuel on the fire. You know, it is not going to help you feel calm. And then alcohol, you know, people get in these cycles, understandably so. They're just trying to calm down, and that becomes a coping mechanism. But, you know, alcohol is going to create a situation where you're calm, and then it comes out of your system, and then your anxiety is worse. And so the next, and also if it's at night, you don't sleep well, so you're not rested. And you get this whole cycle. Well, then you're going to have coffee, and then you're going to be anxious, and you're going to have alcohol, and then you're going to calm down. So not even talking about addiction or anything like that, but, you know, as you're trying to recover, you know, these are not things that I recommend having in your diet.
Well, I mean, I always just think about like alcohol as it's like a disinhibitor, right? But you're just sort of buffering yourself in a way and like putting the brake on something. But if you're then taking caffeine to kind of hit the gas pedal, it's really a tough thing to balance.
Right. But even with alcohol, I mean, it is a depressant, and it causes anxiety in the withdrawal of it, and not even like dependency withdrawal, just the withdrawal of the alcohol from your system. And so if you're already anxious, you know, it is not going to help you the next day.
Sure. Yeah. Well, speaking from an emergency medicine perspective, as a nocturnist,
you see
those alcohol people are my people. So I got you on that. Good. So what else kind of, if you could put out there in the world a couple of things about anxiety that you wish that like your potential clients who are struggling out there, who don't know yet how to access care, you know, what about anxiety is important that we all know and understand to kind of have a baseline?
I mean, I think that really recognizing when the scales have tipped. So, you know, knowing that we all have anxiety, and it can be very productive, when does it start to take over? Really having that insight so that you know when you need to get help. And a lot of times we can't do it in our own brain. You know, we need to talk to other people
to see ourselves from the outside.
Right. And so But also, one of the things that anxiety will trick you into doing is avoiding. And this is what I talk about all of the time, is that the more you avoid what makes you anxious, the smaller your world becomes. The more anxiety takes control and owns you in some way. So really making a list, and of all of the things that you're anxious about, and just taking it one at a time, and forcing yourself to do these things over and over and over. If it's, driving on, the highway, drive on the highway every single day, on and off, on and off, on and off. And your anxiety is going to go up and it's going to come down. And every time it'll be a little bit lower. So,
well, you're retraining your brain in a way,
right? Right. Yes. It's right. So
that's great.
Just to recognize, avoidance is not, put that with alcohol and caffeine. Just don't do it.
Yeah. Okay. Got it. Top 3.
Right.
So awesome. It's been really great to talk to you.
Yes.
I know that you have a ton of resources for people to read and empower themselves through kind of their own education on this topic and a million other ones. Mm-hmm. And so tell us how to find you, number 1, to be your patient if you're near you in Connecticut, and then also how to find your blog and your bookstore and how to follow you on social media. And if you can just say that now, and then make sure you put links in the comments here so people can find it.
Sure. You can find everything from my blog, which is drmelissawelby.com, /blog/.
Yeah.
And so, I write this blog to help empower people to take control of their mental health, and to, it's all about sort of understanding what different things are and what people can do about it, like exercise, things that you can do on your own to be, help yourself feel better. I have a bookstore on my website that, has all of these, resources that I've compiled in terms of the best books for each condition. And on Facebook, I'm Dr. Melissa Welby.
Great. I was going through those resources the other night, and I was like, this is a gold mine. I'm going to work tonight. I can't wait to have my first patient that I can start giving them these resources. So it's really great. So we're going to close up here in a second, but just as always, everybody can find more information about Holist and about our Weight Science to Weight Wellness program and our developing network approach to integrative care at www.holisthealth.com, and then on any social media platform at the handle @holisthealth. And so, Dr. Welby, it was awesome talking to you.
Yes, you also.
And thank you for joining me on this Medical Monday. And make sure you put those links in the comments so that we can get people to you to keep learning.
All right, great.
Okay, take care.
Bye.
Bye.
Bye.